Hi, my name is Aaron Gerds, and I'm the Editor-in-Chief of ASH Clinical News. Welcome to the June edition of From the Desk of. We have lofty goals for the care of patients with hematologic disorders. We always want to improve the outcomes and do better by our patients. A lot of these goals are internal, just things we have in mind every day as we go about our practice and our research. But some of these goals are external too. For example, the Biden recently renewed their efforts through the Cancer Moonshot Initiative to reduce the death rate from cancer by at least 50% over the next 25 years. How do we make these advancements in care? Well, we take observations from clinic to the lab, unravel the biologic mysteries, and then translate those biologic findings back into clinical research and clinical trials to bring new therapies to patients. And really that last step is under threat. And not under threat from regulatory issues or other factors, but really from a workforce shortage. And I'm not talking about hematologists here. I'm talking about other research personnel, both patient-facing like research nurses, as well as those focused on regulatory issues and data entry. The whole infrastructure is under massive pressure with this workforce shortage. Why does this shortage exist? Well, there are probably a lot of influences on the shortage that have led to this well before the COVID-19 pandemic, which is the thing we most often blame as of today. In this article, this feature article, will really walk through the workforce shortage, the contributors to the shortage. How is this shortage affecting our current conduct of clinical trials and clinical research? And what are some ways to move past this, to improve the efficiency of the way we move new treatments into clinic, that we can continue to move the field forward at a fast pace? In addition to this feature article, we'll do our typical news coverage, and we're going to cover a rare disease and shed some light on Paget-Schroetter syndrome, which is also known as effort thrombosis. We're going to pull back the curtain on Dick Champlin, a man who's dedicated his entire career to transplantation, and we're going to move beyond borders, beyond our own borders, to take a look at a healthcare volunteers overseas project in Peru. So all this and more is in the June edition of ASH Clinical News. Until next time, keep the blood pumping.